After verifying the patient's identity using at least 2 identifiers such as first and last name and date of birth, place your patient in a supine position with their arms above the head. To evaluate for rotation, check that the anterior superior iliac spines are at equal distance from the table. The possible anatomical landmarks for the centering of the axial laser light are the iliac crests or the upper edges of the pubic symphysis. For example, in this video, we had chosen to place the centering point on the iliac crests with the external axial laser light. Make sure that the lateral laser light is at the mid-thickness of the pelvis and that the longitudinal laser light is placed in the median sagittal plane. Remember to close the doors of the examination room and perform proper hand hygiene, such as a rub with alcohol-based hand sanitizer. Select your patient from the work list, then click Patient Selection. Verify the pre-filled information and fill in the weight and height. Finally, choose the appropriate protocol. Check that the patient's position on the table matches the one indicated. Note that the patient's orientation is feet first. After checking the scan parameters, click on Confirm. On the keyboard, move the table and initiate the acquisition when the buttons flash. Repeat to obtain a lateral view. Click on Next Series. Place your slices box on the frontal or AP localizer image in such a way as to cover from the iliac crest superiorly to the lesser trochanters inferiorly and cover all of the soft tissues laterally. Then check on the lateral scout view that the pelvis is well covered. If applicable, remember to check the accurate positioning of the organ dose modulation to protect the organs at risk. Check the consistency of the acquisition parameters, often pre-configured, and check your reconstruction boxes. For the acquisition of a pelvic CT scan, you will need at a minimum a smooth reconstruction filter for the evaluation of the soft tissues and a sharper or edge enhancement reconstruction filter for evaluation of the bone structures. Before continuing, check that the predicted dose is consistent with the diagnostic guideline values. Click on Confirm. On the keyboard, move the table and proceed with the acquisition when the buttons are flashing. Verify the absence of patient motion on the acquisition. After clicking on End Exam, you can perform Multiplanar, Reformat or MPR, and possibly 3D volume rendered reconstructions. At the end of the examination, accompany the patient back to the changing room and tell him or her that they can get dressed. Provide the patient with any post-examination instructions as indicated at your facility.
Thanks for watching. For more great clinical content and special offers on CE credits, follow us on socials.